Welcome everybody to tonight's presentation. We have Dr. Linda Jager here from Iowa Cancer Specialists.
Hi.
And she is going to be working with us on a presentation called Frankly Speaking About Cancer Treatment and Side Effects. So before we get started, I just want to go through a little bit of housekeeping for everybody. For those of you who are joining us via Zoom, you are muted at this time. You can go ahead and unmute yourself at any time that you want to ask a question, or you can use the chat tools to ask your question. And for those of you who are joining us on Facebook Live, I'm looking to my right because my other computer monitoring Facebook is up over here. You can go ahead and just chat in any questions, and I will make sure that we get those asked during the presentation. We'll go ahead and share our presentation slides. So a few things we're just going to talk about today is how to best partner with your healthcare team, whether that is if you go to Iowa Cancer Specialists, who is sponsoring this presentation this evening, or one of the other local providers. We'll talk about some different common side effects, those of you who are living with cancer, whether that's in treatment or post-treatment, and then we'll have some general Q&A as well. These slides were medically reviewed just last May, so not too long ago here. But the tips that we're going to be talking about are really for the person with the diagnosis or the loved one. So it's just a chance for you to educate yourself, get some additional support, and what we all need right now, have some additional hope and courage through our treatments. A few resources I just briefly am going to go over from Gilda's Club. We are part of the cancer support community. So we just want to make sure that everybody is aware that we do have a helpline. The number is on the screen, 888-793-9355. That is a number that you can call when you need additional support and Gilda's Club Quad Cities is not open. During this national or global pandemic here, they have extended their hours over the weekend. So we want to make sure everybody realizes that's an extra way to get support. We have our Cancer Experience Registry tool, and that's a great tool that helps us really kind of focus on new research and studies for people who have a cancer diagnosis or for the caregiver. So it's just a community where we collect information. There's different surveys and forums on there. And then our education and our policy institute use that data for a larger scale optional work. Open Options is one of the very few one-on-one programs that we do here at Gilda's Club. Many of you know us for our one-on-one programs, but this is great because it's for those of you who might be facing a change in your treatment path. Maybe you're not sure if you want to continue on with a certain treatment, or maybe it's to the point where you're trying to discuss what your initial options are. Maybe you are new to treatment and you're not sure if radiation, chemotherapy, immunotherapy are right for you. We won't tell you what questions you should ask your doctor. This is a program where you meet one-on-one with one of our social workers, and we help you go through an evidence-based practice where you really come up with a great comprehensive list to go ahead and further empower yourself to ask the right questions of your healthcare team. And then finally, Frankly Speaking About Cancer is our educational series. So that is where these slides have come from for this evening's workshop. Some of the takeaways that you'll get from tonight is just, I can't emphasize this enough, just being more knowledgeable and empowering yourself about your treatment. We'll talk a little bit about some prevention and management of certain side effects. There's a lot of great tools that you can use to track your side effects, appointments, and your treatments. And I do have copies of that planner that I will be sure to get to everybody who attends this workshop. I was supposed to hand them out to you tonight, but you know how that works with social distancing. We'll talk about your support systems, how to advocate for yourself, and just making choices that are right for you. So I am going to go ahead and turn over the screen to Dr. Jager. And again, please chat in your questions at any time. We'll be monitoring those. And Dr. Jager, if you want to just kind of let me know when you're ready for me to advance slides, we'll kind of go from there.
Sure, that's fine. So this is just talking about understanding your treatment. I think it's really important because each cancer diagnosis is different and each individual is different. And the treatment that may work for one may not work for another. So you really understanding what are your choices, why the oncologist is choosing that treatment for you as an individual. And then also thinking about what are those side effects that can be caused by the drug, both while you're getting it and then maybe even some long-term side effects can occur. And most of the time, the oncologist, either the oncologist themselves or I do some of this teaching in our office. We have a nurse practitioner who does that. We kind of call that chemo teaching, even though it may be something more than even chemo, like if it's immunotherapy, we still call that teaching. And it's just really important for you to understand what your treatment is, what kind of side effects can have, and knowing your plan, like how often you're going to get that treatment, for how long. Those types of questions are very important. And then when we're going over that information, we usually go over as a part of that the common side effects that you will have or could have. Just because we say it is a side effect doesn't mean you'll have it either. That's the other thing to remember. And often, I know at our clinic, we hand you kind of a booklet of stuff, of all the bad stuff that can happen. And if anybody reads the packet inserts of any medication, you wouldn't want to take it. So I'm not really sure how beneficial those whole packets are, but I do think you understanding the most frequent and common side effects. And then if you have any side effects, bringing those up is really important. So you can go ahead and advance the slide. So it's really about partnering with your healthcare team and communicating with them. And here's some really great ideas. I think it's really good to write down your questions before you go to the doctor and bring them to your appointment. So we've started going to a system where we're actually having people come in and get the teaching before they get the treatment, like a day or two before. That way you have time to kind of digest what this treatment might be doing to your body and how it's going to be effective. And that way, if you have more questions before you actually get the treatment, you have a time where you meet with us again and you can kind of ask those questions about it. And I think writing them down is really important. Having a planner is also very helpful. You can kind of track any side effects you're having. We're going to ask you questions about that because that'll affect how we treat you. Love the idea of bringing a friend or family member. It's a little harder now with COVID. It's because we don't want to expose as many people. We're still allowing some of that, particularly for those initial visits. But there is a risk involved with every person we bring in. And then, of course, you want the doctor to know all of the medications you're on, including supplements and vitamins and anything over the counter, because that can affect the treatment. So you want them to know what those supplements are, what those vitamins are, and any medications you're on. Go ahead. Whoops, I think you went to, so yeah. So other things that this talks about, I think it's important to ask them, well, what are the most common ones? What can I expect in the upcoming weeks? And then are there any long-term side effects? The next is about intimacy with your partner or other emotional concerns you might have. That may be harder for you to bring up, but I think it is important for you to develop that relationship so you can talk to them about that. There are other resources though, as well, nutritionists, social workers. Gilda's Club offers a lot of support. I think they're one of our go-to. Pastoral care, it's a whole body experience. And we'll kind of go a little bit more into like fertility and other things as we go on. So be sure you build a good team to support you. Go to the next slide. Oops, it goes twice. So the complementary and alternative medicine and integrative medicine, I've actually had additional training in that. And so I do some of that with our patients. It's usually focusing on nutrition, exercise, relaxation. Acupuncture can be very helpful, sometimes chiropractic techniques, healing touch, guided imagery, meditation, physical massage, And then there are also herbal medications that can be helpful. But if you choose to do any of those, I think it can be used in combination with all the traditional treatments, but you need to talk to the oncologist about that, because there are some times when you don't want to be taking an herbal with a particular chemotherapeutic agent. So that's just something you really should talk to your doctor about. But I do think they have some benefits. There's definitely some clear benefits to some of these therapies. You can move on. Okay, treatment options. So the first that we're going to talk about it here is chemotherapy. That's a lot of times we just kind of make it a wastebasket term. Chemotherapy is what was the only type of therapy we used to have when I first started in medical school. And it is a treatment that affects the whole body. So it goes in usually by IV. Sometimes it's oral, but it's directed to kill rapidly dividing cells. And it can vary, different types, different doses. It depends on the type of cancer that you have. So that's kind of our traditional therapy. Next slide. Radiation therapy. That's where we're using radiation to kill or damage the cancer cells. It can be an external radiation that's aimed at a particular site where it kills those rapidly dividing cells. And it depends on the cancer, where it's located, and how we're treating it, whether it's just a couple of times or if there's several weeks of therapy. There's also ways of putting in things that are radioactive, especially prostate cancer. I kind of think about that, where they put in radioactive seeds into the prostate gland itself. And there is sometimes you are giving off some radiation if you're carrying that around. So there's some special precautions with that. Okay, move on. Surgery. That's probably the most common way we both diagnose and treat cancer. If we can cut the cancer out, get rid of it all, that's the best usually for the patient. Sometimes we have to give like chemotherapy before we do the surgery because the cancer is too large, or it's just the way that we'll get the best response depending on the cancer type. So we use surgery both for diagnosing, staging, which is just telling us how far has the cancer spread, how large is the cancer. That's kind of what staging tells us. Surgery also gives us tissue, and that's really important for treatment. It also helps us with the treatment by removing it. Sometimes we call it debulking. That just means that we're taking not all of the cancer out, but as much as we can get out so that the body has less cancer cells to deal with. So treatment can be better and the patient's life may be better. And then reconstruction is what occurs after that initial surgery, where we're trying to restore function and appearance of a body part after affected by cancer treatment. Next slide.
As I'm clicking on to the next slide, we did have a few people sneak in a little bit late. So I just want to do a reminder. Everybody who's joining us via Zoom, you are muted, but you can feel free to unmute yourself at any time if you have a question to ask. You can also use the chat tool to ask a question, and then I will go ahead and relay that. We've also had some more people join us via Facebook Live. So again, if you use the chat on Facebook, just put your question into the comments area and I'll make sure that those get asked as well. Thank you.
Yeah, and Kelly, just let me know if there's any questions and I'll take those at any time. Sometimes it's best to ask your question when you have it, so you kind of keep it in your mind. So we talked about chemotherapy, we've talked about radiation and surgery. Some of the newer and exciting therapies that have been developed are what we're going to talk about next, which are targeted therapies. These are more specific to the cancer cells themselves. There are specific genes or proteins that might be on the cancer that we have been able to develop drugs that kind of target that particular protein, say on the surface of a cancer, or a particular pathway within the cell, like tyrosine kinase inhibitors, or a group of cancer treating drugs that affect the way that the cell controls growth. And so if you have a particular gene in your cancer, so that's where we're doing this genetic testing on your cancer. So when they take that surgical biopsy, it's sent to a lab and then they test for these genes so they can say, oh, you have this gene, we can now use this targeted therapy. Targeted therapies can be given IV, sometimes they're a pill, or sometimes they're just an injection. But not all cancers can be treated by targeted therapy. So we kind of have to know the genetics of the tumor, or if a particular receptor or protein is on the cancer cell. And but it has shown to be, if you are able to do that, it's a very effective treatment. Go to the next slide. Immunotherapy is another.
I have a question. When you talk
Sure.
about, I'm sorry, but I just have one question.
Sure.
When you talk about the genetics of the tumor, you're not talking about the genetics that they find when they do genetic testing in you. That doesn't, like, and if they find, say, a mutant genes that you have that cause cancer, that therapy isn't used on that type of treatment, is it?
No, that's a little different. No, it's actually looking for particular proteins or particular genes expressed in the tumor. Maybe more active things like that. Not like the BRCA or those other genetic tests. Yeah. The immunotherapy, whoops, no. We'll go back to that slide. I think we're going the wrong way. There we go. All right, immunotherapy is when we are using the body's natural defenses to identify, attack, and kill the cancer. So they're actually usually like antibodies or proteins right now are the most common type of immunotherapies. And they actually kind of like target the cancer cell so that the body knows, hey, this is a cancer cell, let's take it out. Again, not all cancers can be treated this way, but it can be very effective. They're usually given IV, and they can be given along with other chemotherapies. So sometimes we use a combination of things because cancer cells are mutated cells, right? So they can mutate as a cancer and change so that maybe one time the chemotherapy was working, but now the cancer has figured out, oh, we're not able to divide anymore, and now they mutate. And so that's one of the kind of cool things about the immunotherapy is that you can use the body's own natural defense to identify the cancer. And then if the body can identify the cancer, then it can take those out. There's some really interesting immunotherapy research that's going on. It's called CAR T cell therapy, where they actually take T cells out of patients. And they take the cancer, the genetics, the cancer tumor, and they kind of activate your own T cells to kill that cancer. And then they kind of make them multiply and turn them on, and then they re-inject them into you. So that's really exciting because that would be a wonderful way to take care of cancer. So, I mean, because we all have cells that are probably mutating. The cancer occurs because our body isn't able to identify or isn't able to kill that cancer cell. So kind of bolstering the body's defenses would be, Herceptin is like an example of a biological immunotherapy, if you've ever heard of that drug. So there's a lot of them out there, but that's just one that you might have heard of.
I'm just going to ask a question that we hear a lot during groups. Targeted therapy and immunotherapy both aren't available to all types of cancer at this time. Are there certain cancers that do tend to be treated more often by one versus the other?
It's really variable. So I think that's what, like we used to think of cancer by organ systems. So like breast cancer, lung cancer, colon cancer. And now we're starting to do that genetic testing. So we're looking at the tumors more like, well, is that a HER2 positive cancer or not? Because if you're not HER2 positive, then like Herceptin won't work. well, there's only a certain percentage, a pretty small percentage of breast cancers that are Herceptin positive. So, and they are trying to find more and more of those. I think that's where a lot of the research is going into these types of therapies to develop them so that hopefully someday we'll have it for all cancers. I mean, that's what we hope for. Does that answer your question, Kelly?
Yes, it does.
Okay, good. You want to move to the next slide then? Okay, palliative care is something that I do here at the Cancer Center and something I've been trained in. And it's not the same as hospice care. That's at the very bottom of the slide. And I think that's really important. Now, palliative care can incorporate hospice care, but really what palliative care is about is looking at that whole person and saying, are we managing the symptoms that the cancer is causing or the treatment is causing? And those symptoms could be pain, it can be the stress of the cancer, it can be a variety of things, constipation, all kinds of things. And we know that we're not just physical beings, we're also emotional beings, we're spiritual beings, we're social beings. And so in palliative care, we try to do a complete assessment of the patient and look at that whole thing. And you know, if I have pain that's physical, that's one thing I can treat. But if I have pain that is, let's say, social or spiritual, even pain, and I don't treat that or address that, then my pain's not going to get better. So palliative care is really, the focus is how do I improve the quality of life for that patient? So addressing all the pain would be one of the things we would need to do. And usually there is, you know, often palliative care can pull in other people like social workers or counselors or nutritionists or other people that may need to be a part of that healthcare team that have expertise. So that's really what palliative care is supposed to be for the cancer patient. We move to the next slide.
I'm going to repeat real quick what you said. It is not hospice. You can still be doing your curative treatment. That's
Definitely.
something that we hear that confusion a lot.
Yeah. Okay, so now this is a whole list of common side effects, and we're going to go through each one of these kind of individually. So I'm going to not read all of those to you. All right, fatigue, that is just so common for the cancer patient. You know, your body is going through a lot, both with having a cancer as well as going through the treatment. So it is normal for you to feel exhausted and worn out, unfortunately. But there are things that you can do to try to help combat that fatigue. You know, asking for help, which is not easy for many of us to do, is one thing. And then also setting realistic goals, you know, do the things that you can do on the day you can do it, and make sure you schedule that way. Go ahead to the next slide.
Interrupt real quick. There's a comment, not a question. Just, you are the best, Dr. Jager, and a whole bunch of other emojis following that you'll have to go look at.
Thank you. Thank you. All right. So fatigue, to restore your energy. You know, it sounds crazy. Why would exercise make me have energy? But you know what? Exercise does so many good things for our body. We actually have these little organelles in each one of our cells. They're called the mitochondria. And when we exercise, we increase those. And do you know what mitochondria do? They make energy for the cell. So exercising actually increases those. So that increases your energy. So exercise, but again, you have to do it in moderation. You have to listen to your body. Always listen to your body. And of course, always talk to your doctor before you take on any exercise. Taking a short nap can really help. Power napping, you know, but if you spend a couple hours, then you're not going to sleep well at night. So you don't want to do that. So you can even set a little alarm on your phone. Try to go for 20 minutes. That seems to be very restorative. And then you want to really work on sleep hygiene and try to get at least 8 hours at night. So some of the things to help you sleep at night are just turning off your devices an hour or so before you go to bed. That light that's hitting your eyes actually inhibits melatonin, which helps us sleep. And if we turn off those devices, that helps. And having a set schedule helps too, because the body actually has hormones that regulate that sleep-wake cycle. So if we go to bed one night at 8 o'clock and then the next night it's 2 a.m., well, then our body is all messed up. So try to have a set bedtime. I mean, it's not like you're a kid, and you can always stay up late once in a while. But if you have that set bedtime, it seems to help your body's just natural rhythms flow better. Eating a nutritious diet. If we don't have good fuel in, how are we going to have any energy? So I'm all about eating lots of vegetables and fruits. So, and then meditation, guided imagery, prayer, those can be very helpful and restorative. Even doing like deep breathing will help you feel a little less fatigued. And then be sure you're talking to your doctor and nurse about fatigue. You may be anemic, which is another side effect we're going to be talking about, and that can cause fatigue. So sometimes one side effect can have multiple causes. So just kind of think about that, and don't just assume, oh, it's just because I have cancer, I have fatigue. All right, we can move on. So anemia, infection, and bleeding. So these are always very, very common side effects for almost all of our treatments. And that's because those cells in our bone marrow produce the cells that help us fight infection. That's our white blood cells. Our red blood cells are what help us carry oxygen around. And when we have low red blood cells, that's called anemia. And then platelets are these little tiny cell fragments that actually help control bleeding. And all of those both the white blood cells, the red blood cells, and the platelets can all be decreased by cancer treatments. So we check the CBC is the frequent one that you will get before you get treatment. And if those are low, they have side effects. And the next slide kind of talks about each one of those. So let's go through those. Next slide. So anemia, again, is that red blood cell. That's what's carrying our oxygen around. And if you are anemic, you could be short of breath, particularly when you try to exercise or move around. Your heart rate might increase because the body's trying to get more oxygen. So it's going to pump that fluid that it has around a little faster. So if you have any of those symptoms, sometimes you can feel lightheaded. That would be another thing that might be anemic, especially if you stand up quickly. And sometimes we can treat anemias both with replacing the red blood cells, so getting a blood transfusion is pretty common. And now we have growth factors that we can give patients that have low counts as well. You may have an iron deficiency or B12 deficiency that you develop, and those can also be tested for and treated with nutrition. So that's another way to treat anemia, depending on what the cause is. Next slide. Neutropenia is the decrease in the white blood cells. And our white blood cells are what help us fight infection. And the treatments can destroy the white blood cells. And the problem with that is then we're more prone to getting an infection. If we have any type of fever, and we define that as 100.4 degrees, or even if you have like really bad shaking chills, that would be even if you don't have a fever, you should be calling your oncologist. And you might not know that you have a low white blood count, right? So we need to check that always in our cancer patients because that's something we need. There are growth factors now available that we give to help stimulate the bone marrow to make more white blood cells. And that can help us prevent infection. If we get infection while we're neutropenic, while antibiotics help us fight infection, it's really our own body teamed up with the antibiotics. So we need both. There's like different side effects you can get even from the treatment. So like say Neupogen is one of the things we give to boost the white blood cell count. And sometimes that can cause some bone achiness or bone pain just because you're stimulating those white blood cells. And there's some different ways that you can actually taking Claritin can help prevent that. So there's different tricks and trades to the treatment. So do talk to your oncologist about all of your symptoms so that they can help you navigate through that.
One question that came in on the slide is, what is being cold with no temperature control? Just kind of that constant cold feeling.
Yeah. Well, one thing that we have to always check, depending again on your treatment, is to make sure your thyroid gland's still functioning, because cold intolerance is a symptom of hypothyroidism, meaning that we don't have enough thyroid hormone. But it also can be just kind of a circulation issue as well. Or if we're anemic, we can be a little more cold too. So that could be part of, could be a lot of different reasons to cause that kind of symptoms in a patient. So it kind of be individualized.
Okay.
Those are kind of some of the things that come to mind. Okay. All right, so signs and symptoms of infection, that shaking, chills, sweating. Anytime we have redness or a rash or swelling. So let's say you get, a cut and it gets red, swollen, that could be a sign of infection. Headaches with a stiff neck, I would say. Always tell your oncologist about a headache. Headache in itself can or may not be associated with an infection. Sore throat, cough, shortness of breath, chest pain can all be signs. Sinus pain or earache, burning, pain, or difficulty with urination, urinary tract infection. Diarrhea or having pain with bowel movements can also be a sign of infection. So if any of those occur, you really do need to be talking to your practitioner. Go to the next slide. Okay, how do we prevent infection? Boy, there's a lot out there on this now, like wearing our mask, right? And of course, the number one thing is washing your hands often. And we all should be doing that all the time. And if nothing else, COVID's taught us to do that more. Avoiding crowds and people who are sick, very important. Washing your fruits and vegetables before you eat them, especially if you have that low white blood count, is important. And then also cooking your meat, your eggs and your seafood. You want to, if you touch raw meat, if you're the one preparing the food, you want to be sure to wash your hands and not get any of that in, because they can contain bacteria. I mean, one of the reasons we cook our meat is because we want to get rid of those bacteria. Children or adults who have had a live vaccine, within the last 2 weeks, you don't want to be exposed to them. Not all vaccines are live, but like polio is one of them that is live. There's a couple of them out there. So you just want to make sure if you have a grandchild or an adult who's had a live vaccine, you don't want to be around them within 2 weeks, especially if you have the low white blood count. Wearing gloves while gardening or washing dishes, again, just to prevent any type of infection that could occur, just an extra layer of protection. And then pets, that would, I would think of, like, I don't think you should probably clean your cat litter if you got a low white count, those kinds of things. And then again, just talking to your doctor about that. So you might get out of some of those nasty jobs, I guess. And then if you yourself are considering any type of vaccine, always talk to your doctor before getting any vaccines. And a lot of times you can get like the flu vaccine and those things. So, all right. Bleeding, okay, those little platelet guys, those are what helps to put the little plug in the artery if you get, or a vessel, whatever gets cut. And if they're low, we don't have enough of them to make a blood clot to stop bleeding. And you also may find that just a tiny little bump, you're going to bleed more and you get a bigger bruise. You can even get tiny little red dots on your skin, and that can be an indication that you don't have enough platelets. So if you have any type of bleeding from any part, we want to know what your platelet count is. Medications that can affect the platelets are aspirin. Also, any of the like ibuprofen, naproxen, any of the non-steroidal anti-inflammatories or pain medicines, mostly over-counter pain medicines, can, not Tylenol, can affect the platelets. There are some herbal medications that can affect platelets too. Even fish oil can make you less likely to clot. So that's another one to kind of be concerned about if you have low platelet counts and you're at a higher risk for bleeding. At least while you have that lower count, you wouldn't want to be taking those things or monitoring those things. And again, everything's a risk and benefit, right? So it's something you need to talk to your doctor about. So if your doctor has you on an aspirin for a reason, don't stop it unless you talk to them about it. Next slide. So if you do have a low platelet count, you want to try to avoid bleeding. So using a soft toothbrush, not using a toothpick, or blowing your nose real hard, or using a sharp razor. Most cuts, if you just apply pressure, it'll stop bleeding. You may have to apply it for a little bit longer, but that can help. Obviously, no football or contact sports. You want to be careful with anything you put up your bottom, right? Because you have a low platelet count, you start bleeding in your rectum, you can't really put pressure there. So we don't want to put things up there if you have a low platelet count. Same with constipation, that can be tear the lining of the intestine, and again, you can bleed more if that happens. And we can transfuse platelets too. So if your counts get really low, sometimes you're bleeding, we will transfuse platelets. It's kind of interesting though, like platelet counts are usually 150,000 platelets in our blood, and they have to be less than 10,000 sometimes for us to even give you a blood transfusion if you're not bleeding, you know what I mean? And if you're bleeding, we usually like it around 50,000, but kind of depends on where the bleeding's coming from. But in general, you can live with a lot less platelets than we normally have. So
there's a question that came into about platelets. Do platelets affect skin tearing, etc.?
Well, they don't really affect skin tearing necessarily, but they are part of that healing. Platelets really actually help a lot with wound healing. I also do wound care, and skin tears, a lot of times you've lost a portion of the skin, and the platelet actually in it has growth factors which help the skin heal. So in a way, if you had a low platelet count, it definitely could affect skin tears. Skin tears are more commonly caused just because we have lost this. As we age, we lose that tissue underneath the skin, the subcutaneous tissue. That's what gives us wrinkles. And that's also kind of a layer of protection. And so the skin is thinner, and so it's more prone to tearing. So, and then if we're not eating as well as we should, not eating enough protein, those things can affect the skin itself. But the platelets do have an effect, but aren't really like a cause. Does that make sense? Okay. Then we'll go on to the next slide. Okay, pain. The cancer itself can cause pain, or sometimes our treatments cause pain. But no matter what the cause is, we need to treat it. And the other thing is that pain doesn't always mean the cancer is getting worse. And I think that's really an important message to hear, that just because you're having pain doesn't mean your cancer is growing, okay? When we have just any kind of inflammation, so that could be your body actually attacking the cancer, there may be inflammation from that, and that can cause pain because pain is caused by swelling and inflammation. When you're a cancer patient, there's a very low likelihood that you'll get addicted to pain medications when they're prescribed by your doctor. That's important to know as well. And I think it's really important to talk to your doctors about pain medications. I think, you need to have the appropriate amount of pain medication and use it as you need it. And that's the key there. The next slide. When you have pain, it's really helpful to your doctor if you can explain exactly where it is and how it feels. Is it a sharp pain? Is it more of an ache? Does it come and go? What makes it better? what makes it worse, and then rating it. And the reason we ask you all those questions is that gives us, as the providers, information on what might be causing the pain. Okay, so a sharp pain is different than a dull pain. And a pain that comes and goes is different than something that's there all the time. And it also helps us with understanding, how effective our treatment is of the pain too. So sometimes patients have a hard time answering all those questions, but maybe being prepared to answer them would be helpful. If you maybe write it down or something like that, because we do want to treat your pain. That's important. Okay, we can go to the next slide. If pain medications are prescribed, then you should take them as prescribed. A lot of times pain medications, though, are prescribed as needed. That means we're putting you in control of when you take it. But you don't want to wait till you're in so much pain you can't stand it, because then it's really hard to get ahead of that pain. And you also don't want to take more than the doctor says, or a whole lot less. And sometimes we will put people on long-acting pain medications, and then they're taken more as a scheduled situation. And sometimes even short-acting pain meds we will give as a schedule, again, just to get your pain under control. And constipation is one of the side effects. Whenever we give pain medicines, you always get constipated. That never goes away. A lot of the side effects with pain medicine, like sometimes you can feel kind of fuzzy headed. Sometimes that gets better with time, but constipation never gets better with time with pain meds. It's always there. So you should try to be proactive. So I really think we should try to have a bowel movement every day. Okay. I know sometimes when you're on pain meds, it may be every other, every third day. You don't want to go 3 days without having a bowel movement. That's just going to cause more pain. So I think being very proactive and talking to your doctor about, well, what do I do when I get constipated, and being proactive and taking something so that you're not getting constipated, or, drinking enough water and making sure you have fiber and moving. Those all help with constipation too. We can go to the next slide. And you want to be careful, because like say some of our pain medicines will have Tylenol, or acetaminophen's the other name for Tylenol, in them. So you don't want to double up or take a bunch of Tylenol and your pain medicine necessarily. So you need to talk to your doctor about how you're using your over-the-counter drugs with your pain medicines as well. And I really love yoga, deep breathing, muscle relaxation exercises. They really work. They can really work to help manage pain. And they don't have any side effects, and they only have benefits. So I think they're a really good thing to do and to try. That doesn't mean that all pain can be controlled that way. I don't believe that. I think we need these medicines. But I also think adding these other things in is a great way to put you in control of your pain. And that's that last thing. You have the right to have your pain controlled. So be sure that you're an advocate for yourself.
I'm just gonna, since you talked about yoga so well, I'm just gonna put in a quick plug, reminder for people that we do offer yoga for cancer every Monday and Thursday from 1:30 to 2:30. And we also have chair yoga classes. So we very much focus on poses that help with a lot of the side effects that we've discussed this evening.
Yeah. And I think one of the wonderful things about yoga is it also teaches deep breathing. And that is part of, I often tell my patients, you have the sympathetic nervous system, which is that fright, flight, pain system. And that's the system that keeps us going kind of crazy. And then the parasympathetic is what balances that. And yoga is one of the things, and deep breathing initiates that. And when we're in our parasympathetic nervous system, more in that state, that's when we heal. So we want to try to get into that state as much as we can. Nausea and vomiting, very, very common, but it's not all treatments. Like, patients will say, I don't want to take that treatment, I'll get this. Well, you might not. And we can do there's a lot of different treatments for the nausea and vomiting. Sometimes we will give medications IV with the treatments to prevent it. You can take medications before you get chemotherapy to control nausea. And there's more than one medication out there now that control nausea and vomiting. So I think that we've got some good medicines out there for that. If you're feeling a lot of nausea, maybe a lighter meal, and having it more frequent might be a better way. I also have found that ginger is very helpful for nausea, and a natural substance. It also helps your immune system, which we want to boost as well. You can make a ginger tea or a ginger water. I just take a fresh ginger root and I cut it up and I boil it in some water, and you can ice it down and put just a little bit in your water, or you can drink it as a tea, and it can be very helpful. There's also ginger candies and things like that you can use as well. So that would be another more natural way to treat nausea and vomiting. So the next slide. All right, so it's talking about, eating the small meals and then the food you eat, right? Certain things are going to cause more nausea. So fried, greasy foods, probably not so good. But you may find that there's an odor or a certain food that's a trigger for you. Sometimes foods that are too cold or too hot can also be a trigger. And there are acupressure and acupuncture also I think very good to try, because they cannot hurt you and they can only help. So no side effects really with those. So next slide.
Well, on the topic of food, real quick, a question that just came in.
Sure.
What is your opinion on fasting before and after treatment?
So there is some good data on fasting. Again, it depends on the individual. So I don't want to blanket it, because if your weight is low or you're losing a lot of weight, we have to be careful with fasting. Or let's say you're a diabetic, that's another, and you're on insulin, you have to be careful with fasting because you can get into trouble. So there is some evidence that fasting during chemotherapy treatments can be helpful. But again, I wouldn't go complete fasting, but eating lighter probably wouldn't hurt you. But you would need to talk to your healthcare provider, because it really needs to be individualized. But there is some evidence that fasting slows the cell division of all of our normal cells. It doesn't really affect our cancer cells that as much. And then the thought is that the chemotherapy attacks more of the cancer cells. There's out in California, they're doing some research. They have these different fasting mimicking diets that they're using with cancer patients, but the research isn't completely out yet. So it's just still somewhat of a theory, and it needs to be individualized. Again, I would not just do that without talking to my provider. So constipation, okay, real common problem. Drinking at least 8 to 12 glasses of water a day is a great idea, even if you're not constipated, but definitely if you are. And then exercise, moving, again, very, very important. Adding fiber can help. I think I love the vegetables there. Probably beans are okay for most people. I'm not as big into grains, but they can help. Fruit is very important too. I find that if you got to be careful again, if you have, if your kidneys are functioning normal, sometimes magnesium, particularly magnesium citrate, there's a supplement that you can take that can help with constipation. There's a couple of different ways to treat constipation more naturally. And definitely having just a good healthy diet can make a difference. It says if you've not had a bowel movement in 2 days or have abdominal pain, then talk to a doctor. And again, I think the goal should be for all of us to have a bowel movement at least once a day, because if you think about that, that's the way we get rid of toxins in our body. So we want to have that moving. So if that's possible, that's what we want. And there are a lot of over-the-counter constipation medications too. Miralax is a pretty natural one. If you're having really rock hard, solid stools, that helps bring moisture in. And then also, you know, senna, and there's some teas and different things like that that you can do with constipation as well. Right, we'll go to the other end, which is diarrhea. And it's funny because some patients will have constipation at the beginning and then they'll develop diarrhea later, or they'll have diarrhea at first and then have constipation. So you'll see diarrhea and constipation listed on almost every medication I've ever prescribed as a side effect. So it really, our GI tract is really affected. We call diarrhea when you've had multiple stools, multiple times. So that's, and then kind of keeping track of that is helpful. Noticing if there's any blood in the stool, what it looks like, the doctor's going to ask you. So look in the toilet, that can give us information. And then there are certain medications that you can take for diarrhea as well. You're losing a fair amount of water as well as salts when you have diarrhea. So you need to be replacing those. So making sure you can drink either a sports drink, which is, I would prefer a low carb one, and water is important. And then because you're having multiple bowel movements, that rectal area can get very irritated. So you want to be sure you're treating that kindly whenever you're having diarrhea as well. The next slide. Small frequent meals, low in fiber, can be helpful. And then avoiding very hot or cold drinks, caffeinated products, or alcoholic beverages. The caffeine and the alcohol both dehydrate you, and you're already dehydrated when you have diarrhea. So that's why we want you to avoid those. Milk products can really cause diarrhea. Some people are lactose intolerant, and that can cause diarrhea in itself. Certain foods like cabbage, broccoli, and soy can also cause gas and bloating. So you want to maybe avoid those. And I think we should always avoid greasy fried foods. So, and anything that's, you know, too spicy for you could trigger. And I think you just have to kind of figure it out. Everybody's different as to what causes the diarrhea, but definitely food can be involved in it. So go to the next slide. Mouth and throat changes. So you want to, again, the reason the mouth and the throat are going to have a problem because they're rapidly dividing cells. That's what we're kind of attacking. Mouth sores, you won't want to use an alcohol-based product. First, it'll be extremely painful if you had a sore, but it also dries out your mouth and makes you more prone to having a sore. So just read the content of your mouthwash if you're using one. I mean, you can just use a salt water or a baking soda mouthwash a couple times a day if you need that. Good dental hygiene is really important. And looking for any sores or any tenderness that you have. Thrush is a common thing that patients will get. It's usually looks like a white coating on your tongue, and it's a fungal overgrowth. Again, because your immune system is compromised with the cancer treatment or the cancer itself, that can cause that thrush to develop. If you've had antibiotics recently, that can cause thrush to develop. And that needs a particular prescription medicine to treat it. So you need to let your doctor know if any of that develops. Go to the next slide. And then because your mouth's going to be sore, you're going to have to avoid like acidic foods like oranges and lemons and things like that. Anything that's hard or crunchy, popsicles or ice chips might be helpful. And then you may need some pain medications, and there's different ones that we can give that help kind of numb the throat. You just got to be careful though, because then you definitely don't want to take something that numbs your mouth or throat and then eat something too hot or too cold where you injure the tissue. So again, just be thinking about that. Go on to the next slide. And then you can also have your mouth kind of dry out, particularly if you have like radiation. It's not uncommon. So sipping on water throughout the day can help. Sometimes having a candy in your mouth and sucking will help produce more saliva, and that's what keeps our mouth moist. And then adding wetness to the food through a sauce or gravy may also make it more easy to eat. Very common to get changes both in taste and smell. Sometimes it's a zinc deficiency that causes that. And if you have a lot of diarrhea, sometimes you get zinc deficient too. So there's a lot of us are zinc deficient. So that could be something that can help with taste and smell problems. So just something to think about. Hair loss, not all treatments cause hair loss, and not all people have hair loss if the treatment causes it, so can cause it. So and the other good news about hair loss is that it's temporary. It normally grows back. It sometimes grows back in a different color or a different texture. If you know that you're going to lose your hair, I think you should try to plan that in advance. Maybe purchase a wig before you lose your hair, just to help with that transition. I feel like it's harder for women because, men do lose their hair and it's kind of more of a natural thing. But us women, when we lose our hair, that's really hard on us. But it could be really hard on men too. So I don't want to be sexist, but I think that it's something that we need to think about. There are wig banks and different places you can get a wig. And I think that's important to feel good. If a wig would be helpful, I think it's effective. You want to go to the next slide. Also wearing, if you don't want to wear a wig or it's just too uncomfortable to wear a wig, there's the hats, the scarves. There's also you want to make sure that you're not getting sunburned, obviously, because usually we have hair that prevents that. And if it's in the winter, our head gets really cold without the hair. So we might need to wear more of those hats and scarves and turbans. And then sleeping on a satin pillowcase might feel better too, because it can be kind of painful a little bit when you first lose your hair. And see, it says both men and women. So I was being totally sexist there. Can feel depressed or embarrassed about their hair. But I think talking to other people can be helpful. There is some interesting research on scalp cooling. I don't know if any of you have heard about that. I don't think any of us have access to that. It's not covered yet by insurance, and it costs like somewhere between $1,000 and $3,000. I know that Dr. Friemel has been looking into seeing if we could somehow get that, but it's like this thing that you wear on your head and it cools your scalp and it prevents hair loss, but it's not, I think it's 50% of the hair loss, like you lose less than 50%. So you still have some hair loss with it. So it's not like a perfect treatment either. It's not like you're going to keep your hair all the way. So I think there's a lot of things to kind of think about there, but that's just kind of one of the exciting things that they're investigating to see if that would be helpful. Kind of interesting. We can go to the next slide. Okay, our nerves also can get damaged by the therapy. So if we start getting numbness or tingling in our fingers or burning sensation, we definitely want to tell our doctors about that, because we can adjust dose, we can do different things to try and help that. There's different medications that can help with that. Then there's other nerve problems, like if you start losing your balance, or if you have any hearing loss, or your thinking's not clear. Those are things you need to tell your doctor about right away as well. Now, sometimes the side effect of the treatment is this peripheral neuropathy, where we actually lose sensation either in our fingers or toes. And if that happens, you have to be careful, because now we can't sense where our fingers and toes are, and we can cut ourselves and we can injure ourselves. And then if we're having trouble with balance, obviously we got to think about, well, are there any, rugs that we're going to trip on, or, do I need handrails in the bathroom? Make sure you're wearing shoes. A lot of patients that I see in the wound clinic have these big wounds on their feet because they can't feel their feet, and then they step on something and they don't even know they had a thumbtack or something in their foot until a week later, when pus is draining out, and they finally notice a drainage because they can't feel. So if you do develop any neuropathy, really looking at the bottom of your feet A lot of us, as we get older, can't look at the bottom of our feet. Yoga helps. And so then have someone else look at your feet, you know, because you don't want, especially if you have any of this neuropathy, that can be a common side effect really from a lot of our treatments. So something to think about. All right. Chemo brain, difficulty with thinking and learning. And that, you know, I was doing a little research today on that. I'm like, what actually causes chemo brain? Well, we really don't know. Some thoughts are it can be from the therapy itself. Some are also just, it's an emotional, physical draining time. And so when we are taxed to our max, and I don't know how you can't be when you get that diagnosis of cancer, then your brain just doesn't work as well. And so we need help. And so here's some helpful tips on this slide of making lists. You can do it on your phone now. You can tell Siri to do it. You can have Alexa do it. There's all these people that are there to help you electronically. You can be old fashioned and have a planner and write it out if you want. And then organizing things, you know, like keeping your keys in the same place, designated place for your glasses. I just use these cheaters. I have like 100 pair all over my house, so I don't have to find them. And then eliminating distraction, trying to focus on one thing can be helpful. Multitasking, probably not a good time to be multitasking, because then you get nothing done because you just can't keep focused. And I think keeping notes and using the resources you have can be very helpful. And talking about it too, I think too, through the support groups and things can be helpful. And there's a lot of helpful tricks. So sexuality and fertility, important issues, often not talked about. I don't think very often in the cancer clinic, but something that can be talked about. You may not feel like having sex because you know you're going through this. It's a lot. You're physically drained. You could have some erectile dysfunction if you're a male. There's concerns if you're younger and diagnosed with cancer about the loss of fertility. There are things we can do about that as well. There can be pain for women with intercourse, especially if you're on hormonal therapy, because you're blocking the estrogen, which is what helps lubricate that area so that vaginal dryness occurs and early menopause can occur. There are treatments for those, and there are things that are safe that you can use. So again, talking to your healthcare provider and each other can be very helpful. Something not all of us are comfortable talking about our sexuality, but I think it is something important to our whole being, and so should be addressed. And talking to your partner as well, so that they understand what you're going through. Birth control, if you're a younger person and getting chemotherapy, many of these drugs will cause birth defects, so you don't want to get pregnant while you're on chemotherapy. And then you can, if you're going to be getting chemotherapy that could affect your fertility, there are ways to preserve your eggs and sperm that are available. Not always covered by insurance, but something that you can look into. And then there are other ways to feel connected to your partner if sex isn't appropriate at this time. Then, you know, just coming up with other things that might make you feel more connected to that one, your special someone you love. We'll go to the next slide. So you want to talk to your doctor about whether you want more children after cancer, right, as early as possible, and then check with your insurance company. So, and there also is adoption in other ways, is what that last last point was, which I think is important to think about too. So go on to the next one then. Okay, so hair and skin and nails all rapidly divide, so they're affected. So really common to get skin changes and nail changes when you're going through treatment. You can get blistering of the skin. Sometimes, particularly with the immunotherapies, they can cause a hand and foot kind of syndrome where you get these blisters and it's an inflammation. Again, that can be treated. So you just need to make sure you're telling your doctor about those things. And you want to be as gentle as you can on your skin. So not real hot water. You want to use a good skin lotion. If you're going to use a lotion and you're getting radiation, you need to talk to the radiation oncologist about that lotion to make sure it's safe. You want to make sure that the fabrics against your skin are as soft as possible. And again, no extremes in heat or temperature. And then if you're having really difficult problems with your nails, let your physician know. Again, some of the nail stuff can be nutritional deficiencies too. Sometimes it's just caused by the treatment though. Go to the next slide. Not uncommon to get itching from the changes in your skin. You don't want to go in hot tubs and jacuzzis, especially when you have like a low white count, because again, you get infections. And they're too hot really for your skin at this time. So more of a warm, lukewarm shower. You can use oatmeal baths, moisturizing soaps, pat dry, and then the creams can be very helpful. And make sure you're thinking about your sun protection as well. So wearing things on your lips and your head and protective clothing. And of course, I am not a proponent of tanning beds ever. So again, we don't need that. Skin and nail changes, don't bite your nails or wear fake nails. I think, again, the fake nails might just be because of, again, higher risk of infection underneath that nail. That would be the reason. But I would ask my physician about that. It would depend on your treatment and your counts and things like that. Same with the manicure and pedicure because of infection. And then if you're wearing gloves when you do dishes, that helps prevent your skin from drying out if you're having those problems already. And then moisturize. So, all right, immunotherapy side effects can be mild to moderate. Again, there are a lot of the itises, so there'll be inflammation of either some organ. It could be your lungs, it could be your GI tract, it could be your skin. They can be mild to moderate. Sometimes we just adjust dose or we hold dose. Doesn't mean you can't have the therapy later. Just be sure as soon as you develop any kind of inflammation somewhere or any symptoms, you're talking to your oncologist about it so that they can adjust the medication, and don't let it go so that it doesn't develop into a severe problem. A lot of times they'll start out mild to moderate, and if we address it then, it doesn't go to severe. So that's why we want you to tell us if you're having any problems if you're on immunotherapy. And for immunotherapy, diarrhea, breathing problems, eye problems, stomach upset, fever, sudden change in your energy or headaches, low blood pressure, chest pain, you're not urinating, thinking problems. Really, it doesn't matter what kind of therapy you're on, any of these you should be talking to your doctor about. So even immunotherapy. Okay, we'll go to the next one. All right, living with cancer. I kind of like that last slide because it had a garden and healthy vegetables. That was pretty awesome. Look at all those colors. Yay, plug in for color. So let's go to the next slide. I do think that it's really important to address our mental health when we have that cancer diagnosis. We shouldn't lose hope, and it's easy to lose hope. And again, it's easy to feel that loss of control, and it's very difficult to live with uncertainty. And we may feel isolated and alone because our roles may have changed because of our diagnosis. We can't do the things we used to be able to do. We may not be able to hold our job down while we're getting treatment, things like that. So those are universal challenges of all patients living with cancer. And it can happen at the time of diagnosis or years later, honestly. And so I think it's important to address those needs that you have. We'll go to the next slide. And our emotional distress causes effects in our body. You know, remember I talked about that sympathetic, parasympathetic nervous system? Our body doesn't know if it's a tiger attacking us or we just feel threatened. And it could be that diagnosis that's threatening us. And it causes the same thing in our body. But we can change the way we frame things and look at things, and it can help us. So it's really common to have anxiety and mood swings and irritability and not be able to sleep and feel a lot of different things, or just not feel normal anymore once you've gotten the diagnosis or while you're getting treatment or even years after. But I think it's always good to get help. I think we all need someone to talk to. And sometimes it's good to have a trained counselor to talk to, because sometimes our family and friends are also dealing with their own stuff with our diagnosis. And having that neutral person, a counselor, can really give us perspective. I think a lot of life is better when we can gain some perspective. And so talking either to your chemo nurses, your physicians, the Gilda's Club support people, counselors, all of those people, and you maybe a pastor, maybe a chaplain at the hospital. We all need different people at different times, and we all need to be there for different people at different times. Maybe it's the person in the chemo chair next to you that you have to talk to, and so I think it's very, very important not to ignore emotional distress, because it can turn inward, and we don't need that. We don't need that added. And that's maintaining that positive attitude. So what can we do? Writing down your thoughts. I think journaling is an excellent way to get perspective on your thoughts. And I call sometimes I have toxic thoughts. I bet we all do. I know we do. And so sometimes just naming that toxic thought and canceling it and then replacing it with a positive thought. Okay, so you can't just cancel it, you got to replace it. So I think that's really important. It's shown to be effective. Spending time with friends and family, a little harder with COVID, but we can do Zoom and we can talk and we can do other things. Taking care of you. A lot of times we don't do that self-care. We really, really need that self-care now. Connecting with your spirituality. And spirituality doesn't necessarily mean religion. It can be, just your connection to a higher power, if you believe in such a thing, or just your connection to other people could be your spirituality. For me, that spirituality is such an important role in my life. I couldn't get through half the things I get through without my connection to the higher power, to my connection to the Lord. So if you haven't had that connection, sometimes when we are faced with mortality, that's the time we explore that. And I think it's good to explore that. Then practicing meditation, visualization, yoga, Tai Chi, all of those are great ways to take a break. We've already talked about exercising. And then doing hobbies is really good too. Like there's art therapy and music therapy, drawing therapy, all those things can be really fun. And for me, getting out in the dirt, digging in the garden, I actually like to weed. Okay, it's weird, but that is therapeutic for me. You have to find what's therapeutic for you. For me, it might be very stressful to try to sing because my family would all scream, but for you, it might be the thing that you really like. So I can't play music either. So we all have our gifts and talents, and I think they're important to incorporate. And just because you're struggling with a disease doesn't mean you can't, you should try to get that back if you've lost it. I think that's important. So setting goals, I'm a big goal setter. Some people just enjoy the journey. I don't know. I like setting goals, having a strategic strategy to reach each goal, finding the resources, knowing that you're never alone. I think that's really important. I think especially with COVID, I feel alone. It's isolating. And I think it's natural to feel that way when you get a diagnosis such as this. But I do think that there are resources, and I really applaud Gilda's club in doing the Zoom sessions. And I'm thankful that you guys came today, even though I couldn't be with you in person, which I totally love more, but this is the best we can do, right? So I think it is important to feel empowered, and we all have power. We really do. We just have to claim it and take it. So next slide. These are just things, again, a palliative care doctor kind of talks about this with you. Advanced directives, living wills, that's kind of what you want done if bad stuff happens. And while most of the time we don't want to talk about that or think about that happening, it is good for your family if you've done that work. And it may be good for you to do that work. In Iowa and Illinois, we have forms. If you don't want everything done, there's one in Iowa, it's called an I-post. In Illinois, it's called a post. And a healthcare provider can fill that out. And when you have one of those forms instead of something that your lawyer does, that actually is a medical order that can be followed by ambulances and hospitals and other care providers. So those are kind of important documents. You may or may not be ready to do that, or you might not need that, but that is something that a palliative care doctor often talks to people about. But your oncologists, social workers, other people can do that as well. Durable power of attorney, that's important for healthcare decisions. So if for some reason we can't ask you what you want, you kind of have to identify who you would want to make those decisions. Now, in the states, they have different laws of who makes those decisions. So if you're married, it's usually your spouse in most states. That's who's going to get to decide. Well, if you don't want your husband or your wife making a decision, you'd rather have your kid or somebody else or your best friend, you need to make that have that done legally, but just filling out some paperwork. And that way, you also need to, when you make that person your healthcare decider, you need to tell them what you want, because then they're going to be on the spot saying, I don't know, they can't talk to us. Because as long as you can talk, we're going to do it, what you want. But it's really difficult. And it can be such a gift to your family to do some of this hard work, particularly if you're not doing well and are struggling. Doing this work can really, really be a gift to your family, because then they'll be honoring your wishes. And that's what we all want, is to honor people's wishes. So while the conversations are hard, and the other thing is they're never in stone, right? You can change your mind. So if you might get way, way better and then you change everything, and that's fine. But I do think they're important documents to think about, and some people never do, and that's okay too, because everybody's an individual. But I do see it as a gift to families, because I have been on the other side, particularly in the hospital, with patients that are critically ill, and the family has no idea what the patient wants, and that's really hard. So then there's the financial power of attorney. That's probably more important. You do with a lawyer. You have to do that with a lawyer, and that's who's going to take care of your money after you can't talk to us to tell us what you want done with your money. The do not resuscitate or allow a natural death order, that's that I-post or post form kind of incorporates that. It also goes a little deeper. It talks about feeding tubes and ventilators and things like that. But those are orders that have to be signed by a doctor, so for those to be honored. And then your will is who gets your money after you die, right? So it's good to have a will. So if you have things you want to go to certain places, so that's helpful to have that. Does Gilda's Club have resources to help with some of that, Kelly?
There are some law firms who have been either willing to do some pro bono or sliding scale work for our members. So if anybody's in need of those services, please reach out.
Yeah, because I do think they're important. And again, your healthcare stuff, your healthcare team should be able to help you with most of that. So that shouldn't cost you. Well, visit cost, right? I don't know. All right, next slide.
All right, I think we're on to my slides here.
Yeah.
So while I am covering these last few slides here, for those of you who are still joining us via Facebook, if you want to take some time and put in the comments any final questions you might have. And then those of you who are joining us via Zoom, if you just want to think about your questions when we finish all the Facebook questions, if there are any, what I'm going to do is stop the live feed and then we'll open it up where you can all just kind of ask your questions as well. So Cancer Experience Registry, I did start to talk about this a little bit at the beginning of the presentation, but it's worth mentioning it again because it is a really strong research tool that the cancer support community utilizes. So there are different surveys, and some are by a specific cancer type, and they are adding types all the time. I think 2 years ago, we were at 17 different specialty registries. They added ovarian cancer and prostate cancer last year. And we are hoping, we just pushed back the date because we want to wait until we're in person, but we will be doing a special ovarian cancer experience registry and sisterly advice presentation with Jody Kavinsky from Normalia. So be watching for that on our calendar. But everything that's part of the Cancer Experience Registry is confidential and secure. Your information is not going to be shared with anybody else. It's just purely for some research. I kind of mentioned that we're doing developments all the time. This timeline just kind of shows you where we're at. And I spoke incorrectly. It was acute myeloid leukemia and ovarian cancer that were added in 2018. But we are currently up to 17 or 19 different specialty registries. If you have a cancer type that's not listed here, you can still participate in the Cancer Experience Registry. These are just the ones where we've had enough people with these diagnoses to have a specialty registry. So it's growing all the time. If you don't see your cancer on here, join, encourage others with your cancer type to join, and we'll eventually have those specialty registries as well. So this is something, as that slide showed, we've been working on since about 2013. It's really easy to join a Cancer Experience Registry. You can go to cancerexperienceregistry.org. Or if you're on the Gilda's Club website, if you click on Get Support at the top of the screen and then scroll down that list, there is a link for Cancer Experience Registry there. So since there are some study material on here as part of the Experience Registry, there will be a form where you have to agree to informed consents. You really just need your email address and to designate if you're the primary person with cancer or if you're the caregiver. And then there's a profile that you can go ahead and create. You can also set up personalized pages, and there's different discussion boards where you can discuss your cancer type as well. And also just with everything else through cancer support community, it is chock full of different educational resources as well. Our grassroots movement is really kind of kicking things in gear at the moment, especially with all of the developing issues surrounding COVID-19. I'm actually participating in an Iowa call with Senator Ernst in the near future about adding things like chronic illnesses to include cancer in some of these new incentive packages that they've been developing. But our grassroots movement is where you can join and become a CSC advocate. You'll get up-to-date information, emails, blog posts with everything that our headquarters in DC, our Policy Institute, and then here locally that we are doing to advocate on your behalf. It's really simple to join again. This is kind of a shortened URL on this slide, but again, if you go to gildasclubqc.org, this time you want to click on Give Support because you're giving support as you're advocating for other people. And there might be asked from time to time about different bills or policies that we want to make sure that we're standing behind, where we might ask you to sign your name to a letter to your Congress people. MyLifeline.org is a really great tool, especially during our time of social distancing here. It is where you can set up your own personal connection to your friends and family. You can have a blog on your site where you're posting updates. I really am a fan of the helping calendar feature. So say you are afraid to ask people, but you know that your cancer diagnosis means accepting help from other people. You can use the calendar, and you can even designate somebody to be in charge of posting to your calendar for you, to get rides to your treatment, to run errands, to take care of your kids or your pets, provide meals, all sorts of different things that you might need assistance with during your active treatment. There's a lot of great discussion boards on here where you can talk to people with your same cancer diagnosis. If you're the caregiver, there's some discussion boards for you as well. And those are monitored by licensed mental health professionals. So when really deep conversations do come up, you will get appropriate guidance on those boards. I kind of mentioned the care coordinators as well. If you like the idea of having a My Lifeline site, but you don't like the idea of having to manage it yourself, you just give somebody control where they can do that for you. And then everything is private and secure. I get a little nervous when I hear members talking about using Facebook pages or groups to control their cancer story, because that isn't necessarily your data. You're not really sure what Facebook might be doing with some of that information or who can actually access it. But My Lifeline, it is your personal information. And it is definitely private. You can give your friends and family passwords. If there's that family member that you don't want to know what's going on with you, don't give them the password. It's completely up to you. But again, if you visit gildasclubqc.org, go to Get Support, you'll find a My Lifeline link on there as well. Okay, just want to see if anybody on Facebook has asked any questions. And I don't see any that have come in via Facebook. So I think what I'm going to do for our public Facebook audience is just go ahead and thank you, Dr. Jager and Iowa Cancer Specialist, for putting on this presentation for us and partnering with us this evening.
My pleasure.
And this recording will live on our Facebook page. We'll share it with Iowa Cancer Specialists, and it also will reside on gildasclubqc.org/education. Before we end the recording for Facebook, is there anything you want to wrap up with?
Let's see. Oh gosh, I would just say I think it's really important to look for your resources, and I think there are resources out there no matter what symptom you're having. There are ways to treat it, and be sure that you tap into your healthcare team as well as the other resources that were listed here. I think it's you shouldn't journey on the cancer journey alone. And I think the best outcomes occur when you can tap into that help.
Okay, well, thank you so much again.